Let's talk about these plastics with Dr. Jane Morgan, Executive Director at Piedmont. So you read the study, put your research hat on, and you and I were talking. You feel that they're not holes, but you question the study.
There are some drawbacks, some limitations to the study. One of them is that the device that they use to measure the volume and the amount and the quality of these nanoparticles really has not been validated, hasn't been standardized. And when you read the paper, they actually do state that they're unsure what the utility is of this particular device to reading these nanoparticles.
But still, there were more nanoparticles, meaning the plastic in a liter of water than they thought. So describe people what a nanoparticle is, and should we still be worried or look into this?
George, absolutely. We originally thought there were probably about 300 of these particles per liter of a bottle of water. But using this new technique, it turns out that there are about 300,000 maybe of these particles per bottle of water. And so what does that mean? Are they getting into our system? Do they get into our organs? Do they get into our bloodstream? If you are pregnant, does it cross the placenta into your baby? These are all questions that have not been answered, but that are being postulated because the volume of these nanoparticles is so high. And a nanoparticle is smaller than a piece of hair. Hair is about 70 nanometers. And these nanoparticles are 70 times smaller than that.
Just a fraction, but still something worth looking into. Dr. Jane Morgan, Executive Director at Piedmont. As always, thank you.
Thank you.
George Esther.